Startling results from Stanford researchers. They estimate the infection rate in Santa Clara County may be up to 85 times higher than the number of confirmed cases. And that's not all. KPIX5's Maria Medina is in San Jose with a breakdown of the nation's first community study.
It was nearly a month ago, Governor Gavin Newsom projected about 56% of Californians would be infected with COVID-19 over an 8-week period. Well, turns out, at least here in Santa Clara County, according to Stanford researchers, up to only 4% of the population became sick with the virus.
A tiny prick.
The Stanford study involved 3,300 volunteers.
Could you turn down?
From all over Santa Clara County, tested recently and recruited from social media.
We have a Band-Aid for you in just a second.
Here's what researchers found. They estimate between 48,000 to 81,000 people in the county may have already been infected with COVID-19 by early April. Those numbers 50 to 85 times more than the county's confirmed cases.
I think we all knew that there was a lot of infection going on that wasn't being captured by testing.
UC Berkeley epidemiology professor Art Reingold says the study shows how few people actually get tested. But what the study also revealed was that only an estimated 2.5 to 4.2% of county residents carry antibodies and may be immune to the virus, at least for a certain amount of time.
I always thought that the suggestion that 40 to 50% of the population would have antibodies and be immune was not likely to be true.
The study comes as state leaders begin to discuss the next phase of the stay-at-home orders and reviving the economy. Dr. Reingold says we must be prepared and especially continue to protect the most vulnerable.
We've got a lot of people left in the community who are at risk of getting infected. And so when we lift restrictions and try and get people back to work, the virus is almost certainly still going to be around.
And the study also reveals that the death rate is lower than predicted. Meanwhile, Stanford researchers say they hope to use the study to project death and hospital rates as the pandemic continues. In San Jose, Maria Medina, KPIX 5.